Mr. Ryan. How are you?
I'm fine.
Good to see you again.
3 years ago, the life of Andrew Ryan and his family changed forever. Scientists are now working so that both he and other chronic liver disease sufferers can have a better quality of life. When Andrew was diagnosed with cirrhosis, he didn't expect the disease to be so devastating. His health deteriorated so quickly that his only hope was a liver transplant. The former offshore oil worker eventually had one and now undergoes almost weekly checkups at his local hospital in Newcastle, England.
Every morning when I wake up, it feels better on my legs, and I definitely feel better than I did 2 weeks ago.
To minimise constant visits to the hospital, researchers are developing a platform to allow chronic liver disease sufferers to know when their livers are faltering and need special hospital care, not just regular checkups.
The main advantages that we envisage from the patient's point of view is that their clinical care might be improved, so they might actually have less episodes of deterioration through closer monitoring. Their quality of life should be improved quite significantly if we can do that, because they're not in and out of hospital so much.
So where and how is this liver monitoring platform being developed and tested? The work's taking place at labs like this one in Newcastle, Switzerland. Scientists from a European research project are developing a system aimed at helping patients to easily monitor the chemistry status of their damaged livers.
This machine analyzes a certain number of blood parameters, such as the blood clotting ratio or the quantity of potassium, sodium, creatinine, albumin, bilirubin. A too high or a too low level of all these elements in the blood may be a symptom of a malfunctioning liver.
The platform will also allow patients to autonomously monitor physiological parameters, including heart rate, skin temperature or blood pressure. The continuous monitoring of blood pressure is particularly challenging, and the science behind it requires complex experiments on volunteers.
You cannot use this regular cuff, because then you cannot walk around with that.
1, 2, 3, go.
And then you need several high-resolution signals and combine those to get the blood pressure changes.
With further development and testing, researchers hope their monitoring devices could soon become a market reality.
The wearable device system is very close to being able to be available for use for routine continuous monitoring of physiological parameters. The biochemistry measurements of the blood biochemistry, that would need to possibly be 3 to 5 years from market. The test for cognitive impairment, so that could be within a year, allowing people to monitor their own degree of cognitive impairment.
Well, share me time with my wife, my family. I've got grandchildren now. I don't want to fly to the moon, I just like to live my life.